Welcome to the Deep Dive. We're the place you come to sift through the latest research, studies, all that fascinating stuff to bring you insights that really matters. Today we're taking a deep dive into an area that's often overlooked but is actually crucial in nursing. Spiritual care. We've got this brand new 2025 article. It's from the Journal of Nursing Management by Chen and colleagues focusing on new nurses over in China. And our mission really is to understand the surprising link between a nurse's own spiritual well-being and how well they can provide that spiritual care to patients and stick around, because there's this really interesting kind of unexpected factor that ties it all together. Now, you might be thinking, okay, nursing. I'm not a nurse, so why is this for me? And that's fair. But here's the thing. While, yes, the study is specific to nursing, the idea is underneath it about how your own well-being, your personal state, affects how you perform professionally and how that ripples out to the people you interact with, the people you serve. That's universal. This isn't just about hospitals.
It's about how we show up for others when we're feeling, grounded ourselves. So let's dig in. Okay, to really get into this properly, let's maybe define some key terms first, because words like spiritual health can mean different things to different people. So first up, spiritual health. The World Health Organization, the WHO, they actually flagged this as the fourth pillar of health way back in 1998.
Yeah, that's right. They put it right alongside physical, psychological, and social well-being. It's about achieving a harmony between all four. And spirituality itself, in this research context, it's viewed as that dynamic part of being human,
Yeah.
The drive to find meaning, purpose, connection, maybe transcendence.
Yeah.
It's that fundamental search for what gives life value, and it really helps people cope, especially with big challenges like illness. And there's a cultural point here, too, which the article mentions for its Chinese context. Spirit is often linked to qi.
Ah, interesting.
Yeah, it emphasizes inner peace through, harmonious connections with yourself, with others, with nature. It's not necessarily tied to formal religion.
That idea of qi and inner harmony, that's a really useful distinction. It broadens it out, doesn't it? Beyond just religious practice. So, okay, if that's spiritual health, how does the study define the action part, what they call spiritual care?
Spiritual care is, it's about recognizing and then responding to a patient's spiritual needs.
Right.
So that could mean helping them make sense of things, finding ways for them to express themselves, or supporting their faith if that's important to them. And the nurse's role here is just vital. They're often the first ones, right there when a patient is facing spiritual distress. They can help patients deal with fear, reduce that awful uncertainty, maybe find some inner peace. It's really considered the foundation of holistic nursing, looking at the whole person.
The whole person, exactly. And building on that, we have spiritual care competence, or SEC. What does that actually involve? What skills are we talking about?
So SEC covers a nurse's knowledge, their attitudes, and crucially, their actual abilities to, deliver spiritual care practices. It includes things like their own sense of spirituality, that's the interpersonal bit, how they connect with others, spiritually interpersonal, and then the practical skills, assessment, planning, intervention, and evaluation, all focused on spiritual needs. The research really stresses that SEC is a key occupational skill. It's not just a nice to have. When nurses have this competence, it can seriously boost patients' coping skills, their sense of meaning, and just their overall quality of life.
That really clarifies it. It's a distinct set of skills. Now, this study focuses specifically on new nurses. Who exactly are they, and why the focus on them?
Right, so new nurses here means those who've been in clinical nursing for 2 years or less since graduating.
Okay, fresh out.
Exactly. And they face unique challenges during this, transition phase. A big one highlighted in the study is a lack of good spiritual care education and training. The authors actually state that new nurses often feel, and this is their word, ill-equipped for this aspect of care.
Wow. Ill-equipped.
Yeah. And that, unfortunately, means patient needs in this area often go unmet, which is a pretty significant gap if we're talking about holistic care.
Definitely a gap. Okay, so we've got the terms down. Let's shift to the study itself. How did the researchers actually investigate these connections? What was their approach?
Well, their main research question was about the relationship between spiritual health and spiritual care competence in these new nurses. Pretty straightforward link to test, but more specifically, they wanted to explore the mediating role of something called perceived professional benefit.
Okay, mediating role. So, does this benefit thing explain how spiritual health connects to competence?
Precisely. Does this perceived professional benefit act as a bridge or a pathway, explaining why having better spiritual health might lead to better spiritual care skills? That was the core question.
Got it. And who participated? Who were these new nurses?
It was a cross-sectional study done online. They surveyed 299 new nurses. This was between March and April 2021. They were selected using convenience sampling from 10 large hospitals, tertiary hospitals in Henan Province, China.
Okay. Any key characteristics?
Yeah, a few stand out. The average age was young, just over 21, mostly female, almost 89%, primarily junior college degrees, mostly unmarried, and this is really interesting given the topic. Over 94% reported having no religious beliefs.
Wow, that is interesting. So the findings about spiritual health here aren't necessarily tied to religion at all.
Exactly. It reinforces that idea of spirituality as a broader human quest for meaning and connection, separate from specific doctrines. And most had relatively low monthly incomes, too.
Okay. So how did they measure these abstract concepts? Like, how do you put a number on spiritual health or perceived professional benefit?
They used established, validated questionnaires, standard practice in this kind of research. So for spiritual health, they used the Spiritual Health Scale short form. For perceived professional benefit, it was the brief Perceived Professional Benefit Questionnaire.
Okay.
And for spiritual care competence, they used the Chinese version of the Spiritual Care Competence Scale, the CSCCS. So validated tools for each one.
Right. You mentioned perceived professional benefit, PPB, a couple of times. Let's pause on that. What exactly does that mean, especially for a nurse? It seems pretty important here.
It really is key. PPB comes out of positive psychology. It basically refers to how much a nurse perceives advantages in their job, their conviction that nursing actually makes a difference, that it advances well-being.
So it's about their positive view of the profession itself.
Exactly. It includes things like feeling personal growth in the role, getting recognition from family or friends, building good relationships with patients, having a positive overall take on nursing as a career and feeling like they belong to their work team. It's about seeing the inherent worth and positive side of what they do.
That makes sense. It's about the meaning they find in it.
Yeah.
And how do they analyze all this data to test that mediating idea?
They used a specific statistical model. It's called the process macro for SPSS, Model 4 for those interested in the technical details.
Okay.
But basically, it's designed specifically to test for mediation, to see if that middle variable, the perceived professional benefit, significantly explains the link between the starting variable, spiritual health, and the outcome variable, spiritual care competence.
Gotcha. So it checks if spiritual health influences competence through its effect on how nurses view their job benefits.
Precisely. Does it work because of that perception?
Okay, stage set. We know the terms, the people, the methods. Now for the results, the aha moment.
Yeah.
What did they actually find? What did this study reveal?
Well, first off, they found that the new nurses in their sample had, on average, moderate levels of spiritual care competence.
Moderate. So not terrible, but definitely room for improvement.
Exactly. It suggests that, yeah, there's work to be done in building this skill set for new graduates entering the field.
Okay. Given that moderate level, did they find those direct links they were looking for between spiritual health, job perception, and competence?
Oh, absolutely. The correlations were clear and positive right across the board.
Okay.
Better spiritual health was linked to greater perceived professional benefit. That makes intuitive sense, right? If you feel more centered, you might see more positives in your work.
Yeah, seems logical.
And similarly, better spiritual health also correlated positively with higher spiritual care competence.
Right.
And finally, that perceived professional benefit piece, that also strongly correlated with higher spiritual care competence. So all three were positively interconnected.
Okay, so everything's moving in the same positive direction, but what about that mediating effect? Was perceived professional benefit really the bridge? This is where it gets really interesting, you said.
Yes, this is the core finding. They confirmed that, yes, spiritual health had a direct positive effect on spiritual care competence. That link exists on its own.
Okay.
But and this is the big, but that link was significantly mediated by perceived professional benefit.
Significantly mediated, so it really was the bridge.
It was a major bridge. Get this. Perceived professional benefit accounted for 67.1% of the total effect of spiritual health on spiritual care competence.
Whoa, over 2/3. That's huge.
It's huge. It means that a massive chunk of why spiritually healthier nurses are more competent in spiritual care is because they perceive more benefits and value in their profession.
Okay, let's unpack that. What does that practically mean? for nursing, maybe even beyond?
It means that if you're a new nurse, having a stronger sense of personal meaning and connection to your spiritual health makes you much more likely to see the good in your job, to feel its value. And it's that feeling, that positive perception of professional benefit that strongly fuels your ability and motivation to provide good spiritual care.
Wow.
This study, apparently, is the first to report this specific mediating pathway, which is quite a contribution, and it really clicks with something called the broaden and build theory from positive psychology.
Run and build. How does that fit?
Well, the idea is that positive individual resources, like spiritual health, spark positive emotional experiences, like perceiving professional benefits.
Okay.
And those positive emotions then actually broaden your mindset and build your durable personal resources, including your skills and capabilities like spiritual care competence.
I see. So your inner resource, spiritual health, creates positive feelings about your work, PPP, which then builds your outer skills, SCC.
You got it. It's like a positive upward spiral.
That's a really powerful connection. So stepping back, what are the big so what implications here? Why should, say, hospital managers or nursing educators really pay attention to this?
Well, the big so what is that this study gives us solid evidence base for future interventions. It makes it clear that we can't ignore SCC. If we want truly holistic care, if we want to optimize nursing quality, we have to find ways to cultivate this competence in new nurses. It's not optional fluff, it's essential.
Right. So what are the actionable strategies? If you're a manager reading this, what can you do directly?
Directly, managers can focus on boosting spiritual care competence by nurturing the nurse's own spiritual health.
How? Like meditation rooms or something more structured?
The study suggests more structured approaches, actually. Implementing specific spiritual care education and training programs. They mention things like lectures, yes, but also group discussions and maybe even simulated clinical practice where nurses can safely practice these skills.
Okay, build the skills and the inner resource together. Makes sense. But what about the indirect route? Through that perceived professional benefit piece.
Exactly. That's the other lever managers can pull. They can indirectly promote SCC by actively working to enhance how new nurses perceive the benefits of their profession.
And how do you do that? Give them a raise. Though I guess that helps.
Well, maybe. But the study talks about interventions focused on occupational cognitive evaluation, which is a bit jargony, but
Yeah, what's that mean in plain English?
it means helping nurses consciously recognize and appreciate their own worth, the real value and impact of what they do, fostering a really positive professional perception.
So it's about reinforcing their sense of purpose and contribution,
Yeah.
helping them see the benefits.
Precisely. Showing them, reflecting back to them the positive impact they have, helping them connect with the meaning in their work.
Ultimately then, if we manage to improve this competence, what's the wider impact?
Well, it's a win-win-win. The nurses benefit likely better job satisfaction, less burnout, more growth. Patients clearly benefit. They receive more holistic, person-centered care that addresses their spiritual needs. And the whole healthcare system benefits through improved overall nursing quality. It creates this positive feedback loop.
That makes a lot of sense.
Yeah.
Now, you mentioned this was a cross-sectional study. Like any research, it probably has some limitations we should acknowledge.
Oh, absolutely. Good science always acknowledges limitations. As you said, it's cross-sectional, a snapshot in time.
Yeah.
So we see strong correlations, these links, but we can't definitively say spiritual health causes higher competence, just that they're strongly related.
Right. Correlation isn't causation.
Exactly. Also, the convenience sampling from just one province in China means we need to be careful about generalizing these findings to all nurses everywhere or different cultures.
Sure.
And finally, it relied on self-report questionnaires. People sometimes answer in ways they think are expected or maybe don't perfectly recall things. There's always a potential for some bias there.
Okay. Important context.
Definitely. These limitations actually point the way for future research, maybe longitudinal studies or studies in different settings.
Great points. So let's try and boil this down. The core insight from this deep dive seems to be a nurse's own personal spiritual well-being has this really profound link to their ability to care for patients spiritually.
Absolutely.
And that crucial bridge, that maybe surprising factor explaining how they're linked, is the nurse's own perception of their job's value, their perceived professional benefit.
That's the key takeaway. It's not just what they do, but how connected they feel to its meaning and purpose, and how that stems from their own inner sense of well-being.
It really highlights the connection between the inner life and outer practice. So, here's a final thought, something for you, our listener, to maybe mull over. If understanding your own sense of purpose, your own spiritual health, and seeing the real value in your work, your perceived professional benefit, can so significantly boost competence and care in a field as demanding as nursing, where else? Where else in our lives, whether it's personal or professional, might intentionally cultivating our own spiritual health and boosting our sense of perceived benefit unlock levels of competence, compassion, and impact we haven't even tapped into yet?